And about lymphoma, you know, lymphoma actually it is cancer. Yeah, it is blood cancer which develop in lymphoid organs. Yeah, and often this is lymphoid cells or lymphocytes. Yeah, infiltrate different organs. It can infiltrate even brain. Yeah, it can infiltrate eye, also choroid and retina, and it can infiltrate quite often lacrimal gland. So it is here in lacrimal gland develops these special lymphoid cells or lymphocytes, yeah, and inflammation occurs. Yeah, and of course person will have dry eye. You know what, diagnosis even for us, very difficult for doctors, yeah, but usually it develops some like swelling on the eyelid. Yeah, if we can see some strange swelling on one eyelid, especially upper. We have to suspect that it could be lymphoma, yeah, and we are performing special tests, yeah. But I tell you, just to have idea. By the way, if somebody will tell you that he has lymphoma, do both 3 tests. Mostly it is people over 50 years old, but you never know. There is also pediatric lymphoma, or I mean, somebody who have this diagnosis from a young age, yeah. And of course, about AIDS, you know, about AIDS, it's very, very interesting thing. Certain amount of people are HIV positive and they don't have any symptoms at all. Yeah. And I knew some patients who first came to us. Yep. But I would say it's a multi-organic problem for people who have AIDS, yeah, or HIV positive, yeah. If you ask, and usually I tell you, usually somebody else, because they start to go to different doctors with different complaints, yeah, and somebody do this test. How we can suspect as a doctors, ophthalmologists, yeah. I had some patients with very strange, again, posterior uveitis. There is nothing on eye. Definitely it will be dry eye, but he has some changes on the retina, on choroid, which looks like chororetinitis. What such kind of patients I had in my practice, and I was first who established diagnosis, of course using laboratory tests. So okay, next one is lacrimal gland denervation. You know what? It's very interesting diagnosis. I will try to explain you what does it mean. Lacrimal gland have parasympathetic and innervation. It's a parasympathetic nervous system which innervate lacrimal gland, yeah, and it could be some eye conditions. You can see on this right side of the table, which can cause dry eye through lacrimal gland denervation. And you see, it's very interesting diagnosis. Yeah, you will read later on just to understand this idea that actually lacrimal gland have problem with innervation and eye become dry. But there are certain conditions which can provocate this lacrimal gland denervation. Problem this parasympathetic disease, yeah. And actually, look, very good diagnosis. Keep in mind herpes simplex and herpes zoster ophthalmicus. I would say person who have a history of herpes eye disease, yeah. Herpes simplex, just to remind, it is just staining special this branch staining on the cornea. This will be herpes simplex. And herpes zoster, I'm not afraid to show on myself. Herpes zoster, it have to be some spots on the forehead. Yeah, one side, always one side. And such kind of people often have problem not only with this lacrimal gland denervation, but they have also decreased corneal sensitivity. Yeah. I would suggest if somebody already has this herpes zoster or herpes simplex, and he knows I had some zoster or some herpes in eye. By the way, you have to ask before to put contact lenses. Ask patient if they did not ever have herpes. This is very crucial, very simple question. And especially if you can see some strange opacities, yeah? Young person, strange opacities in the cornea, ask if it was not herpes, yeah? And if it was herpes or you suspect herpes, just check his corneal sensitivity, yeah? If person have decreased corneal sensitivity, most probably it will be also problem with dry eye disease. Yeah, but again, take the table, evaluate. Grade 1, 2, 3, 4. Yeah. How you can check? Just take piece of this cotton, small piece of cotton, and just try to put this cotton or with, of course, microscope on the cornea, and see if cornea is with good sensitivity. A person start to feel pain and start to blink. If person not does not react that you touch his cornea, just check if there is not big problem with dry eye. Yeah. Other group is corneal surgery. Yeah. Again, person who has undergone cataract surgery, be careful, but definitely no any contact lenses for 3 months after surgery. Yeah, because it take at least 6 weeks to heal. Yeah, this limbal incision. Yeah, 6 weeks after cataract surgery healing, and 6 weeks more just for security reason. Just wait. Yeah. Keratoplastic, retractive surgery, all this stuff. Because some of these patients still need some contact lenses. This is a group of people who should be offered contact lenses, not on regular basis, but occasionally. Yeah, as I told you, 3 times per week, 4 times per week, few hours. But of course, I would say all this group of these people needs 3 tests. Yeah, Schirmer, Rose Bengal, and breakup. Yeah. This all risk group, yeah, of that could be these people could have problems, yeah. Here it's very interesting diagnosis, neurotrophic keratitis. Maybe somebody have had my lecture. Neurotrophic keratitis. It's huge corneal sore with huge defect, which does not heal for 2, 3, 4 months. Yeah, of course, however, it could be a person for contact lenses. Never. So, okay, yes, there are not so much time left. Let's go quickly. Again, non-Sjogren syndrome, dry eye. Obstruction of lacrimal gland. You know what? Sometimes we can meet this pemphigus or pemphigoid. It's like cicatrical and mucous membrane. Yeah, you can see I have found quite good picture. Yeah, which develop between bulbar and this palpebral conjunctiva. Yeah, of course you can't put contact lenses, hardly ever. Maybe you can try, but it definitely will be some dry eye. Yeah, and actually it is probably with with lacrimal, small lacrimal glands who are in eyelid, sitting or eyelids. So such kind of patient definitely will have some dry eyes. Yeah, or I would say very often after chemical burn or some other type of burns. Yeah, what we can see, and of course elderly people, but not people for contact lenses. Yeah.